In the realm of Parkinson's disease management, diet plays a crucial role alongside medication and physical therapy. The relationship between what we eat and how it affects our health can be complex, especially when it comes to neurological conditions. Today, we're diving deep into an often overlooked aspect of diet for those living with Parkinson's disease: nuts. While nuts are celebrated for their health benefits, including heart health and anti-inflammatory properties, there's a surprising twist in the tale for individuals with Parkinson's. Not all nuts are created equal in their impact on this condition, and some may even pose risks rather than benefits. We'll explore the nuts that those with Parkinson's should approach with caution, culminating in the revelation of the most dangerous nut for individuals battling this condition.
But before we continue, if you appreciate all the information and the research that goes into making a video like this, it does help out tremendously if you hit the like button and hit subscribe. Thank you, and let's begin.
Nuts are a powerhouse of nutrients, offering a rich source of healthy fats, protein, vitamins, and minerals. They're often recommended as part of a balanced diet for their potential to support health, reduce the risk of chronic disease, and even aid in weight management. However, for individuals with Parkinson's disease, certain nuts might not be as beneficial as one would think. This is due to various factors, including their nutritional content, potential interaction with medications, and their effect on the disease's symptoms and progression. It's important to navigate these dietary waters with care, understanding that the very foods meant to nourish could also inadvertently exacerbate health issues. Let's start with the nuts that, while generally healthy, should be consumed in moderation or with caution by those with Parkinson's. These include walnuts, almonds, pecans, and cashews, among others. Each of these nuts has unique properties that can influence Parkinson's symptoms in different ways. Walnuts, for instance, are lauded for their high omega-3 fatty acid content, which supports brain health and has been shown to reduce inflammation. However, for someone with Parkinson's, the high levels of omega-3 could potentially interfere with medication effectiveness, especially if consumed in large quantities. It's a delicate balance to maintain, ensuring that the diet supports overall health without undermining treatment. Almonds are another popular nut, cherished for their vitamin E content, which acts as a powerful antioxidant. Antioxidants are crucial for individuals with Parkinson's as they help combat oxidative stress, a key factor in the disease's progression. Yet, the high fiber content in almonds can affect the absorption of Parkinson's medications if consumed too close to medication times, highlighting the need for careful meal planning. Pecans, with their rich antioxidant profile, offer similar benefits and considerations as almonds. Their contribution to heart health is undeniable, yet the timing and quantity of consumption need to be managed to avoid any negative impacts on medication absorption and effectiveness. Cashews, on the other hand, are a bit different. They're lower in fiber compared to almonds and pecans, but are high in magnesium, which is beneficial for muscle health and can help manage some symptoms of Parkinson's. However, cashews also contain substances that might interfere with the dopamine production, a critical factor in Parkinson's disease management, making them less ideal for those seeking to optimize their dietary intake for disease management. As we delve deeper into the list, we encounter nuts that pose a more significant concern for individuals with Parkinson's: macadamia nuts, Brazil nuts, and finally, the nut that stands out as the most potentially problematic, the peanut. Macadamia nuts, while delicious and rich in healthy fats, are high in calories and fats. For someone with Parkinson's, maintaining a healthy weight is essential, as excess weight can exacerbate symptoms and decrease mobility. Thus, macadamia nuts should be consumed sparingly. Brazil nuts are known for their selenium content, a mineral that supports thyroid function and antioxidant defense. However, excessive selenium intake can lead to selenium toxicity, symptoms of which can mimic or worsen Parkinson's symptoms. This makes Brazil nuts a risky addition to the diet in large quantities. Finally, we arrive at the peanut, the most dangerous nut for individuals with Parkinson's disease. It's important to note that peanuts are technically legumes, but they're commonly classified with nuts due to their similar nutritional profile and usage in diets. Peanuts contain a substance called L-DOPA, which can directly affect dopamine levels in the brain. While L-DOPA is used in the treatment of Parkinson's, when obtained from dietary sources like peanuts, it can lead to unpredictable fluctuations in dopamine levels. This can potentially worsen symptoms or interfere with the carefully calibrated effects of Parkinson's medications. Moreover, peanuts are prone to contamination with a fungus that produces aflatoxins, compounds that are toxic to the brain and can further compromise neurological health. This brings us to the crucial part of our discussion, the medication used in treating Parkinson's disease. Understanding the interaction between diet and medication is key to managing the condition effectively. Common medications include levodopa, also known as L-DOPA, which increases dopamine levels in the brain, and other drugs designed to mimic the action of dopamine or prevent its breakdown. The dietary intake of substances that can either increase or decrease dopamine levels, such as L-DOPA from peanuts, can disrupt the delicate balance these medications aim to achieve. This underscores the importance of not only choosing the right foods, but also timing their consumption to avoid interfering with the effectiveness of medication. Navigating the dietary landscape with Parkinson's disease requires more than just a keen awareness of which nuts to avoid or consume in moderation. It involves a holistic understanding of how food interacts with the body and the disease itself. Beyond the realm of nuts, individuals with Parkinson's must consider the broader spectrum of their diet, ensuring it's rich in fruits, vegetables, lean proteins, and whole grains, all of which contribute to overall health and may help manage symptoms. For instance, foods high in antioxidants can help counteract oxidative stress, while those rich in fiber can aid digestive health, which can be compromised in Parkinson's. Additionally, staying hydrated and limiting the intake of processed foods and sugars can also have a positive impact on symptom management. This dietary vigilance extends beyond mere nutrition. It's about creating a balanced ecosystem within the body that supports both physical and neurological well-being. By doing so, individuals with Parkinson's can potentially mitigate some of the disease's impacts, enhancing their quality of life. This comprehensive approach to diet, coupled with careful consideration of nut consumption, underscores the importance of dietary choices in managing Parkinson's disease effectively. In conclusion, while nuts are an excellent source of nutrition for most people, those with Parkinson's disease need to navigate their choices more carefully. The interaction between certain nuts, especially peanuts, and Parkinson's medications requires attention to detail and careful management. By understanding the nuances of how different nuts can affect their condition, individuals with Parkinson's can make informed dietary choices that support their overall health and well-being. It's always recommended to consult with healthcare providers or a dietitian to tailor dietary choices to individual health needs, ensuring that the diet complements medical treatments and supports the management of Parkinson's disease. This approach ensures that individuals with Parkinson's can enjoy the benefits of a nutritious diet while minimizing potential risks, leading to better health outcomes and quality of life.